AI in healthcare, future trends, risks, and ethical considerations with Dr. Harvey Castro. Join Dr. Harvey Castro, a leading AI expert, as he dives into the future of artificial intelligence in healthcare. Discover how AI transforms patient care, diagnosis, and treatment while exploring this rapidly evolving technology's ethical considerations and potential risks. Gain valuable insights into how AI can revolutionize medical practice, improve communication, and combat burnout. We'll also be joined by an incredible guest, Brooks Wood, to share his insightful content on this. Welcome to the Wellness Driven Life Show, where you're about to go on a wellness driven ride. Welcome. Let me share a little bit about the guests that we have here today. Dr. Harvey Castro is a renowned ER physician with over 20 years of experience and an expert in AI integration in healthcare. He holds an MD from the University of Texas Medical Branch and an MBA from the University of Tennessee. He serves as the Chief Medical AI Officer at Help.ai and CEO of Medical Intelligence Ops. Dr. Castro has authored several healthcare-related books on AI and regularly contributes to platforms like Fox News and KevinMD.com. Recognized multiple times as ER Doctor of the Year by D Magazine, he is a sought-after speaker and advisor on AI and healthcare innovation. I am so pleased to help welcome to our stage today, Dr. Harvey Castro. Welcome.
Thanks for having me. I appreciate it.
It's an absolute pleasure and an honor to have you here today. I'm excited for this conversation because AI is one of my favorite topics, being used so much by us entrepreneurs and creatives out there in the world. And so let's get diving in on this topic, because at the Wellness Driven Life Show, we want to know about how it integrates with wellness as well. So this is a great conversation. Why don't you start by sharing a little bit more about you?
Yeah. So I'm blessed to say I'm an ER doctor, been a physician for over 20 years in emergency medicine. And I call myself a little bit of a nutty professor in that anything I see, I literally jump in. Any problem I feel or sense, I literally give my 110. And just to give you a quick example, I'm playing with the first iPhone ever. And it was back then they didn't have apps or anything like that. And I'm in the emergency room and we're coding a patient. And the nurse, I tell her, hey, we need to start this IV drip for this person that literally is dying in front of me. The nurse gets a textbook. She starts thumbing through the textbook and says, okay, I got the dose doc, and went and got a calculator and double checked my math and said, okay, here we go. And I'm thinking in my head, I'm like, whoa, that took too long. We need to do something about that. And that something was I created the first IV med app in the world, and it went viral. All the hospitals around the world were using it. And I always like giving that story because it brings you into AI. It was the year 2022, playing the first day that ChatGPT came out, and I'm playing with it, and I'm looking at it, asking all these questions, and it's answering back correctly. And I was in this office, and I went running to my wife, and I said, honey, I'm going to write a book on how to use ChatGPT in healthcare. And the rest is history.
You know what is fascinating to me, Dr. Castro, is how wicked fast it all has been forming. And you said that was in 2022. My gosh. And just ChatGPT and all of the things that is creating now, as far as the video content that it's creating, movie scenes, and it goes on and on and on with the rapid pace of what it can do. And us learning how to communicate what we want it to do, how it can improve us and improve society and all of these things. There's so much of that fear factor sector also involved. And I know that you discuss a lot about that and you have talks on that. So we're going to dive into that. But let's share a little bit about the other guests that we have here today. So let's bring in Mr. Brooks Wood. Welcome. Oh, you're on mute, Brooks.
Thanks for having me.
Absolute pleasure. Welcome to the Wellness Driven Life Show. Now, Brooks, I know that both you and Dr. Castro are doing immense work together, but let's get started by sharing a little bit more about yourself so the audience can get to know you.
Absolutely. So this year will be 22 years for me in healthcare technology. And it's really been centered around the patient experience and patient safety in hospitals. And about 6 years ago, a friend of mine, he died at a hospital in Denver. And it turned out that people weren't washing their hands when they entered in the room. And so I quit my job at the time and I founded a company to track and maintain and make sure that people are washing their hands. Purell is an investor in my company at the time. They still are. And it really was one of those things where I wanted to make sure that I was keeping people safe. I wanted to prevent that from happening to my family and my future self, as well as anybody else. I just had no idea what a challenge that was. And then you fast forward into, several years later with AI, and I started realizing and seeing, what challenges there were, especially during COVID. We didn't have enough people to take care of those that needed help. So I realized that technology had to be something to intervene. And as Harvey was mentioning, ChatGPT had just come out, and I really started seeing that as something as a huge differentiator, right? Being able to conversate with those that can't help themselves and really help those that need help is really what I was after. So.
Brooks, I very much appreciate you sharing that. And I'm so sorry for your loss, but those are the things that really ignite us making a change and a difference. And I strongly appreciate your passion for safety and all of those things, because I come from a strong background of that as well. And it's fascinating to me how we can truly, if we integrate safety into so much of our lives, it really does lead to a more fulfilling life. I mean, we could go into a lot of examples of that, from where you live to what you choose to put on and around your body. It all has this safety feature to it where we protect ourselves and others. So thank you so much for sharing that insight. Now, you two are creating something that is really helpful to the medical community. So would you like to share a little bit more about that and what it is that you are bringing to the forefront?
Yeah, Brooks, why don't you start us?
Sure. Really many things, but ultimately, there's a big challenge in this country, and that's twofold. One is our population is aging. It's aging at a rapid pace. About 10,000 people are retiring every day. Between now and 2030, we're looking at about 100 million people over the age of 65. And that means that there's going to be less caregivers to take care of those people that need help than there are today, because our population is aging, and generally the caregiving population in particular is much older, and the younger population is moving on to different careers. So as a result, one of the big challenges when you start getting older is falling. And as your bones get older, and osteoporosis starts to set in, it's really a huge risk for injury when you fall. So one of those things is falling and breaking a hip. And so what we've been working on is a product called Help with 2Ps.ai. And what that's doing is it's sitting and it's watching and monitoring and looking to see if somebody is trying to, in a hospital in particular, get out of bed by themselves. If you try to get out of a bed in a hospital by yourself, it's a huge challenge. You can easily fall. And if you fall because of the medication or just everything that's around you to concrete floor, you could hit your head and injure yourself pretty bad, or even break your hip again, like I mentioned. So what Help.ai is a product that sits in the patient room, and it's monitoring and it's making sure. So if somebody does try to get up out of the bed by themselves, it lets somebody know, and it predicts early so that it can let somebody know before that happens and try to prevent that from occurring.
Oh,
yeah,
that's fascinating.
And I'm gonna add to it. this is where it's just such a great synergism with Brooks and I working together. Number one, having that IT background, having the vision, having that story where it's personally, he wants to make a difference. And then on my side, having the 20 years of ER experience, clinical gestalt of seeing patients, seeing this in real action where patients have fallen, broken their hips, some have died, some have gone into multi organ damage, failure. And for me, it's really personal because I also have that same mission. I want to do what's best for my patients. And then being able to meet in the middle, Brooks and I, where I understand AI, I understand how it works. And I'm probably not the normal doctor in that sense, but I'm also a physician that understands medicine very well. And then bringing in my entrepreneur spirit with AI, with the medicine, all three together, and then working with Brooks, now we're able to create something special because we're able to combine the best of all these worlds.
Well, that's imperative. I have many guests on the show that want to bring something about, but you're correct. You have to have all of those things. You have to have the know-how to bring this to light. And otherwise, it could take an immense amount of time trying to find people who do and really know how to communicate. The passion has to be behind there. The knowing has to be behind there because of what it is, the root of what you need to have AI do and accomplish with all of the different facets, all of the people involved and the boots on the ground, all of those things really have a play in creating what it is you want it to do and how other people are going to be responding with that information, all of the information that it needs to give and take in. So you're absolutely correct. What are some of the pitfalls that you've been running into with this?
Yeah, Brooks, you want to talk about?
So, some of the challenges is really education. There's a lot of media and a lot of coverage in the media around safety and AI and privacy and all those types of things. And when I started down this journey, it was really talking about the word AI was kind of a bad thing because people just kind of looked at you like, what are you talking about? So we started talking about predictive analytics and those types of things to really try to soften that blow. But now we've kind of shifted to this whole other direction where it's like, are you using AI in your product? And they really want to talk through that. But then they immediately want to jump into what are the safety challenges? What are the issues and privacy concerns, right? So from our perspective, we've really made sure to focus on privacy, safety, all of those types of things from the very beginning. And because we've been very much on the forefront of this and working through it for the last, since 2017, it's not just something that we've just shifted over to the last few years. It's really something that we've been growing to and evolving with as the technology has been coming available to the public that we can really jump onto, right? ChatGPT came out in 2022, but OpenAI, the company behind that, has allowed developers access to that for several years. So we've been seeing products built on top of that in the back end for many years already. And of course, those companies, data is kind of like the thing that they need to keep their products moving forward. So there is a privacy challenge there. But, again, from our perspective, we're making sure that we're following best practices, that we're, making sure that HIPAA guidelines are followed and that we make sure that anything that has patient information is very much protected and private. We're not leveraging, these things that you see out in the public. We're making sure that it sits inside the four walls of a building, of a hospital, to keep things private.
Yeah. And I'm going to echo what Brooke said. Being a physician and talking to my patients, obviously we don't know what we don't know. It's such a black box. Like, what should I ask? What should I not ask? And so educating the public on the good, the bad, the ugly of AI has been really important. And I'm really proud to be part of HELP in that he's able to look at these things with HIPAA and privacy issues and really take it to another level. Like he said, it's not like he just started jumping into ChatGPT or AI because now that's the thing. He's been doing this prior to this blowing up in the last few years. And having that foresight and having that experience that he brings into AI is huge. This is why I'm so excited that I met him and been working with him. I can't stress just the amount of synergism that we both work together and we're able to see things and create new products. And I see it with the doctor eyes and the physician eyes, and he's seeing it from the IT. But the magic that we're doing is just so much fun. Literally, our wives probably get on us because when we call each other, we are on the phone for hours thinking of all these things that we can do for patients.
I think that's when we create the most magical things, and the most impact in the world is when we are that excited about what we're creating. So we'll move into our commercial, and when we get back, let's continue the conversation. Stay tuned. Are you ready to take control of your ride to wellness? Rev up with Driven Living. Visit www.drivenliving.com and buckle up for a journey. Get exclusive access to our Wellness Driven Life Show guest portal, where you can dive deep into the minds of our esteemed guests. Sign up for our newsletter and get insider scoops on these distinguished personalities. It's like having a backstage pass to their life-changing wisdom. But that's not all. You'll also receive a free hug. You heard me right, a free hug. An enlightening ebook from the Driven Living team. Discover the science-backed benefits of hugging yourself. It's a fill-up for your wellness tank. Because at Driven Living, we believe in fueling your journey to wellness, both physically and psychologically. So what are you waiting for? Visit www.drivenliving.com today. Welcome back, everyone. And I am so excited because we're here today with Dr. Castro and Brooks Wood. Now, we're talking about AI and how it has a play with the medical field. And I would love to know from you, gentlemen. Now, we have all of these incredible ideas of how we can bring AI to serve us in the most incredible ways, to save more lives, to get more things done in a quicker manner. And when we talk about the emergent medical fields and the first responding fields, this can be imperative, and it truly does have life-saving capabilities. So, but sometimes we feel like we can't get this out fast enough. Like, even though it's moving very quickly, but we have all of the things where it comes to federal regulations and all of that stuff. And you guys just mentioned that, sometimes people are like, oh my gosh, we have all these risks that are coming to play. But what would you have to say about how that's been playing out for you? Do you feel like you can get this out fast enough?
That's a great question. And the answer is yes. Having the foresight and think of building the house correctly. We're building the foundation correctly. We're doing the things from the get-go correctly. Often when I consult other companies on how to use AI and I'm looking underneath the hood, I'm seeing what they're doing. I'm like, whoa. This is not going to fly in healthcare. Maybe in another vertical, maybe non-healthcare, you could do this, but in healthcare, you cannot. Brooks mentioned HIPAA. Obviously, HIPAA is a big thing. We take that very, very seriously. A lot of startups that I'm also seeing, they don't understand HIPAA completely, and some of the workflow and what they're doing, because my house analogy is totally wrong, and they will be flagged by the FDA. They will be regulated. And so that's the advantage of working with someone like Brooks, that he understands this. And then opposite side as well, there's things that you just said. Just because we can build it, does that mean the hospital is going to use it? Does that mean the patients are going to use it? The answer is sometimes the culture is not ready. And so some of the things that we're doing for the public, for the hospital systems, we're doing that in mind. We're saying, okay, yes, we could do X, Y, Z, but we're going to start with something else because we know that this right now will be accepted.
Yeah. Harvey, do you feel like, I know that you've been on many different shows, you're a speaker, so you're getting a lot of awareness, a lot of engagement. And so do you feel like that is helping you leverage your ability to get this out to the public, or to at least the healthcare?
I love that you said that. Yes, the answer is for sure. I've gotten so many private messages from people around the world saying, hey, Harvey, I really appreciate what you're saying and doing, because you're leveraging your MD, you're saying it from a doctor's voice, saying this is what we need to do, and you're educating other doctors that possibly would not be able to see it, and they trust you and they see it from your voice and they're able to recognize these issues, and now we'll do it. And so I feel blessed that now I'm being coined with the term Dr. GPT, and they're saying, hey, you're the doctor. Like when we have a question for AI, so different hospital systems around the world are calling me. I'm proud to say that the country of Singapore, asked me to be an advisor for Singapore. So in October, I'll be physically in Singapore, meeting with the Ministry of Health, talking to them how to use AI in healthcare for the entire country. So it's really exciting to be able to have that recognition. A couple of months ago, I was on stage talking to the Texas Medical Association about AI in healthcare, had over 1,000 doctors sitting there. And as I'm coming off the stage, the president of the Texas Medical Association comes to me and says, "Harvey, we want you to be an advisor for the Texas Association." And he made it happen. And a couple of weeks later, I got a letter from them saying, "Hey, can you advise us for the entire state of Texas?" So I just feel honored to be able to do this.
That is absolutely incredible. And you're 100% right. It's just going to influence, especially your influence with Singapore, other places around the globe. And so it's immensely helpful that both of you are coming with this, with different backgrounds and different passions. So I want to utilize both of you as an example of, we get to not just have one thing or two things that we're great at, but we can combine and merge so much of our experience, our past skills together to create something really incredible.
For sure. For sure. And this is where Brooks and I call it get us in trouble. We are so passionate about it, and we see so many things because every single day new technology is coming out. This technology is exponential, and our organizations are linear, so they don't move as fast. And so Brooks and I feel like we are ahead of that. We are jumping in saying, "Whoa, you can do X, Y, Z. Could you imagine if we did this in healthcare? Could you imagine if we did this in some other vertical?" And so we have so many things in our pipeline. So I'm really excited that we're able to work together and create these products. The one that I'm most proud of, it's hard to say because people always ask me that, but I'm really excited about health because I see this as really going to save lives. And I truly believe people are not going to die from falling, from all these injuries. And so I'm personally excited to say that we're going to make a difference in the world.
I think the statistics are very high on falls. I mean, especially with our elderly. And so, yes, this is going to be immensely helpful. Now, you both are bringing this into the world, to the light, but I'm curious to know, what are you excited about next? What comes after this?
I'll let Brooks answer that one, and then I'll go after him.
There's a ton of great things, but what I'm most excited about, like right this moment, is the convergence of taking all this AI and from the server side, all this cloud stuff, and sticking it onto your device. When that happens and when that occurs, it makes things faster, it makes things more private, and it makes it so that what you're talking to and what you're interacting with very much is something that you can count on, something that you're not going to be judged by, something that you can get information from in real time that is just there for you and that you can work. It's a Siri that works completely on steroids and is way, way, way beyond that. There's so many more things beyond that, but I just think as we start to see these things get closer and closer to our devices, we're going to see so much more come from it. Things like your AirPods just being able to block out children in the background and dogs barking and so forth is just going to be just one of the easy things to think and look at, right? But there's so much more beyond that.
Yeah, and I'm going to add to that. That's a tough one for me. I tend to buy every little gadget that comes out, even before it's officially released. And seeing some of these tools, for example, I used to work right next to the airport in DFW. And anytime anyone around the world would get sick that was landing in DFW, they would come straight to our hospital. So in essence, I would see people from all over the world. One of the coolest gadgets that is coming out, there's several that are similar. I saw these call them AirPods, but you put them in real time, as you're speaking in whatever language, it translates, and then vice versa. And then I can leverage AI where I can start asking AI and it'll have a conversation with us. So for example, if I'm your doctor and I'm telling you about certain diseases and I want to say it in your language, I can have AI help me consolidate it and say it in your words and in your culture. And use examples from your area. So if you're from South Africa, then it'll use examples of South Africa for your condition. So I thought, man, this is amazing.
Yeah. Wow. It is amazing. And you know, the possibilities seem so uh there's just so much that we can do and create. So, thank you so much, the two of you, for being our guest here on the Wellness Driven Life Show. I want to make sure that our audience knows how to find you, learn a little bit more about all of the things that you're creating, especially those in the medical community. So, www.harveycastromd.com for those of you listening in. And for those of you viewing, I've had it displayed on the screen throughout the show. And it is also going to be in the description below. So thank you so much, the two of you, for being a guest here. Is there anything else you want to share with the audience today?
I'm going to jump in and say, I know as it could be, change is scary at times. I'm going to say, don't be scared. Get on that bike, start riding that bike. The more you ride it, the more you understand it. The more you understand it, it'll be less scary.
I'm going to echo that statement, Harvey. I mean,
Yeah.
that is exactly it, right? Just following the trend and knowing how to use things is really going to be beneficial, because 10 years from now, it's going to be everywhere, and you need to know how to use it now.
Yes.
Those are very wise words to say. And we mentioned that many, many times here with lots of guests who are familiar with AI, and harness its capabilities is to really dive in and get familiar with it and get familiar with speaking with it. Because any other question for you, but as far as my understanding is, the more we understand how to communicate with it, the better it is. And when we communicate in a compassionate way, as if it's, you know, listening in that regard, it's just going to be so much more in our benefit.
Yes.
Wonderful. Well, thank you, the two of you, for being our guests. And thank you so much to our audience, because without you, the show wouldn't be possible. So goodbye for now, and we will see you next time.